my question. I know you've reiterated several times the president's following science. Can you talk a bit about whether or not he's concerned at all that the CDC might be taking too long to issue new mask mandates or even vaccine mandates now that we see cities like New York issuing vaccine mandates?
Look, I think it's important to take a step back and remember what we're talking about here. The CDC evaluates data from across the country, and they will make public health guidance. They will present public health guidance. They do that on a regular, periodic basis. They will continue to do that. And we are always considering a range of options, as we have been from the beginning of the administration. Of course we are, as we should be. They do not make laws. It is the guidance currently that if you are not vaccinated, you should wear a mask. It is the guidance currently that if you are over 12 years old, you should get vaccinated. And regardless, the most effective step we can take around the country is to get more people vaccinated. So that is where our focus needs to be, regardless of where the CDC may or may not land on any additional guidance.
When I talk to experts, they say vaccine mandates would be a big step toward getting more people vaccinated. So I'm just wondering, when you see organizations like nearly 60 coming out and saying, let's at least mandate health care workers being vaccinated, why isn't the White House behind that? What science is telling the White House?
I think I just said we support the step they took. What I'm getting at is the CDC does not determine mandates. The CDC provides public health guidance on what can save people's lives. Getting vaccinated can save people's lives.
So would it be fair to say that, I guess what my question is, does the White House at all see itself standing up, and maybe this is what you're saying now, yes, there should be mandates specifically for healthcare workers or teachers or municipal workers. Does the White House see that as a role that it should be taking in? Is there any danger in not doing that?
I think I just said a few minutes ago that we support the step of hospitals, and that was a guide and could be a guide for us on what to do with our own healthcare workforce here from the federal government, just to give you kind of a sense. I would also note that 90% of teachers across the country are vaccinated, and that is in part because of prioritizing teachers early, a number of them taking the responsible step, of course 90% of them, to get vaccinated. That would be up to schools and localities. There are certain powers that the federal government has, and there are certain powers the federal government does not have. But we're talking about a couple of different things here. One is public health guidance by the CDC, which will be driven by data. That gives guidance. The laws will be implemented by others. They do not make laws. They give public health guidance. Then there are decisions by institutions, by localities, by hospital systems, who may make decisions about how they can protect their workforces. We certainly support that.
Actually, one quick thing on